name's David Keating. I'm an endodontist in Sacramento, and lately something that's made a big impact on my practice is the use of cone beam CT. It's provided a wealth of information as far as diagnosing. You can use it preoperatively, treatment planning, even intraoperatively. I've used it a few times, and it just provides an amazing amount of information in difficult to diagnose cases, whether you're dealing with external resorption or previously a root canal that's failed, and you're curious whether there's possibly a fracture. It provides a lot of information about where the bone loss is, the type, the quality, and it's really made a big difference in my practice. Recently there was an article in the JOE, November 2014, and it talks about using calcium hydroxide versus MTA. It was a prospective clinical study with 230 patients. They followed up over 4 years, and they found that calcium hydroxide versus MTA had a much better long-term prognosis. At the 3.5-year follow-up, you had approximately 80–85% success rate with the MTA versus the calcium hydroxide had success rate of, I believe it was 59%. So from a standpoint of if you're making a clinical decision between the two, MTA does have its advantages in the long term.